This presentation speaks to manual material handling and back injuries for workplace health safety. Manual material handling is the most common cause of occupational fatigue and low back pain. About 3 of every 4 Canadians whose job includes manual material handling suffer pain due to back injury at some time. All these facts make prevention of back injuries a crucial and challenging problem. This document speaks to preventing back injuries caused by material handling in the industrial workplace and is limited to the handling of inanimate objects. Immediate and short-term effects include accidental injuries and fatigue. Sharp or rough surfaces and falling and flying objects are common causes of wounds, laceration, or bruises. The worker can also suffer these injuries by falling or colliding with objects. Fatigue is a common and expected effect. More serious problems related to MMH are long-term health effects resulting in chronic back pain. Back pain can result from various causes. The most common causes are strains and cramps in the back muscles. Back pain can also result from tears in the tendons connecting the back muscles to the spine, or from sprains and tears in the ligaments interconnecting the vertebrae, bones of the spine. Less frequently, it arises from direct damage to the vertebrae or the discs that separate them. A worker can sustain a back injury from a single episode, such as lifting too heavy a load, slipping and falling, or receiving a blow to the back. However, most often, it is not the single episode that causes back injury. It is the repetition, as in manual handling, that contributes most to the occurrence of injuries. Work-related factors include the weight of the load lifted, the range of the lift, the location of the load in relation to the body, the size and shape of the load, distance and duration the load is carried, and the number and frequency of lifts performed. Excessive bending and twisting also increase the risk for back injury. Poor layout of the workplace also increases the risk for injury. For example, shelving that is too deep, too high, or too low causes unnecessary bending or stretching. Lack of space to move freely increases the need for twisting and bending. Unsuitable dimensions of benches, tables, and other furniture force the worker to perform tasks in awkward positions that add stress to the skeleton. Similar stressful body movements occur where work areas are overcrowded with people or equipment. Temperature and humidity affect the worker performing the work. When it is too hot and too humid, the worker tires more quickly and becomes more susceptible to back injury. On the other hand, cold temperatures decrease the flexibility of muscles and joints. This stiffness also increases the likelihood of musculoskeletal injuries. Inadequate lighting in the work area indirectly affects the worker performing the work, particularly where the precise placement of handled objects is important. In compensating for poor visibility, the worker often must handle objects in an awkward position for extended periods of time. Poor lighting on steps and stairways, ramps, and loading docks increases the potential for accidents resulting in back injuries. By misjudging distances, the height of steps, or ramp angles, the worker can easily lose balance and fall while carrying a load. Whole body vibration alone can cause back pain. It imposes a compression on the spine that gradually damages the discs between the vertebrae. Combined with material handling with vibration, multiplies the risk for injury. Thank you very much for listening. Bye now.